We can start now.
Good morning, everyone. Am I audible?
Yes.
Okay, so I'm Richa. I'll be presenting opioid dependence syndrome. Opioids are a class of psychoactive compounds that are used for analgesic and medicinal purposes, but they're often misused. They found opium poppy plant P. somniferum. They can be consumed orally through injections or through inhalation. Smack, which is most commonly abused opioid, is consumed by heating the heroin on a tin foil and then inhaling the smoke, as you can see in this picture. The national prevalence of opioid use is 0.0%, while it's 0.8% in Uttarakhand. Opioids occur both naturally and chemically, and the most common natural alkaloids of opium are caffeine and codeine, and the more common synthetic compounds that are found are heroin, nalorphine, and methadone. There are receptor subtypes that have various functions. The mu receptor works as supraspinal and spinal analgesia, sedation, inspiration, slowed gastrointestinal transit, and modulation of hormone and neurotransmitter release. The delta receptor works as supraspinal and spinal analgesia and for modulation of hormone and neurotransmitter release. The along with its supraspinal and spinal analgesia, works as a psychotomimetic and slows gastrointestinal transit. DSM-5 divides opioid use disorders into 5 main diagnoses: opioid use disorder, opioid intoxication, opioid withdrawal, opioid-induced disorders, which includes anxiety, delirium, depression, and sleep disorders, and lastly, unspecified opioid-related disorders, which occur when the full criteria for the other disorders are not met. Opioid use disorder is a pattern of maladaptive use of an opioid drug leading to clinically significant impairment occurring within 12 months. The symptoms include impaired control, continued use despite negative effects, social impairment, tolerance, and withdrawal symptoms. Harmful use is a pattern of psychoactive substance use that causes damage to health. Diagnosis requires that actual damage should have been caused to the mental or physical health of the user. So acute intoxication is not in itself sufficient evidence of the damage to health required for coding harmful use. Opioid intoxication, transient condition using maladaptive changes in behavior, disturbances in level of consciousness, cognition, perception, and physical symptoms following opioid use. The symptoms occur due to parasympathetic stimulation and include drowsiness, slow or absent breathing, cold, clammy skin, dizziness, discoloration of the lips and the nails, choking, and pinpoint pupils. Opioid withdrawal is a group of symptoms developing after cessation or reduction in opioid use. Opioid individuals of dependence syndrome. The symptoms include inflammation, rhinorrhea, dilated pupils, sweating, diarrhea, yawning, piloerection, dysphoric mood, anxiety, tachycardia, insomnia, hypertension, and vomiting. These symptoms are due to sympathetic stimulation, which cause the anticholinergic side effects. Now, opioid dependence is described as described by ICD-10 as a cluster of physiological, behavioral, and cognitive phenomena in which the use of a substance takes on a much higher priority for an individual than other behaviors that once had greater value. It's a disorder of regulation of opioid use due to repeated or continued use of opioids. To diagnose ODS, at least 3 of the following should occur at the same time in the previous 12 months. A strong desire or sense of compulsion to use due to opioid use, or increased time necessary to use or recover from opioids. Evidence of tolerance such that increased doses of the opioid is required to achieve effects originally produced lower doses. Physiological withdrawal state when the opioid is reduced or stopped. Persisting opioid use despite harmful consequences. Complications due to illicit drug use include Parkinsonism, degeneration of the globus pallidus, peripheral neuropathy, amblyopia, transverse myelitis, and due to intravenous use, complications, AIDS, thrombophlebitis, pulmonary embolism, ischemia, viral hepatitis, and endocarditis. Social complications include drug peddling or involvement in criminal activities, imprisonments leading to unemployment and interpersonal problems. 6.5 times higher, and the life expectancy is markedly reduced as overdose is the most common cause of death. To treat ODS, a thorough history, physical examination, and investigation should be conducted. The treatment can be divided into three main types: treatment of detoxification and maintenance therapy. To treat an overdose, resuscitation is done, followed by maintaining the ABC and administering naloxone, which is followed by a repeat injection in 5 to 10 minutes. Detoxify, tapering doses of buprenorphine is the most effective way to manage withdrawal symptoms. And buprenorphine is not feasible, methadone may be more appropriate. Clonidine can also be used as it reduces withdrawal symptoms. After detoxification, patient is maintained on one of the following: methadone maintenance, opioid antagonists, and lastly, psychotherapy, behavior therapy, group therapy, advice, and education can also be useful. These are my references. Thank you.
Thank you. Can we go to the next presentation before question answers?
Good morning, everybody. Good morning, everybody. Am I audible?
Yeah, you are audible.
Good morning, doctors. Today I'll be presenting the limbic system. I'm Jaskirat Singh Bakshi. I'll be discussing the neuroanatomy along with the neurophysiology.
Sorry for the interruption. Your slides are not visible.
All right. Good morning, everybody. I'll be starting now. I'll be presenting the limbic system. I'm Jaskirat Singh Bakshi. The term limbic system has been used in psychiatry as well as neurology. If we go back to the origin of the word, in psychiatry, it deals with the healing of the soul. So we'll be the soul while talking about the limbic system now. Limbic, which originates from limbus, border, and it refers to a ring of gray matter on the medial aspect of the cerebral hemispheres. In the words of Dr. James Pappas, the hypothalamus, the anterior thalamic nucleus, the cingulate gyrus, the hippocampus, and the interconnections constitute a harmonious mechanism which may elaborate the functions of central emotions as well as participate in the emotional expression. The limbic system is a collection of neural structures which are involved in emotion, long-term memory, olfaction, behavior modulation, and autonomic nervous system function. The 4 F's to remember here would be the feeding, fleeing, fighting, and feeling. This is what our limbic system is important for. On the right side, we can observe the medial sagittal view of our brain, and all the white matter, gray matter structures that are involved in the limbic system. To ease the diagram out for you, I'll be using the following image. Here we have the medial view of a limbic system. If you can observe the C-shaped bordering structure in the green color, it is our limbic, and it has two major parts, which is the cingulate gyrus on the superior end and the parahippocampal gyrus on the far inferior end. The cingulate gyrus is responsible for the sensory input for emotions and regulation of aggressive behavior, while the parahippocampal gyrus is involved in memory processing. Just medial to in this image is the hippocampal formation, which deals with our memory, specifically our spatial memory, and this is involved in our circadian recall ability. The formation is made of three parts, which are the dentate gyrus responsible for the afferent senses, subiculum and hippocampus proper, which is responsible for the efferent senses. Superior to that would be our amygdala, which plays a central role in the system. It's involved in our cognitive processes, along with episodic autobiographical memories. It's involved in our facial recognition and often called the window through which our brain is able to perceive the outside world. As the corticomedial nucleus, which deals with our emotional and behavioral responses to the olfaction, along with basolateral nucleus, which is responsible for all the other sensory, emotional, and behavior responses. Then we have the hypothalamus, which, as we remember, controls the autonomic nervous system. It helps in regulation of our body temperature, the food intake, the water balance, our thirst mechanism, the sleep-wake cycle, and controls the endocrine system. The hypothalamus has the mammillary bodies, which are involved in the recognition memory and the ANS nuclei. These will also be discussed in the following pathways that are in pathways that I'll be discussing further along. The thalamus is constitutes of the anterior nuclei. That's the memory pathway or the Papez circuit. There's the medial dorsal nuclei, which is responsible for the emotions and behavior. Then we have the septal area in the blue color, which plays a key role in the feeling of socialness and bonding. And then there's the habenula, which is the emotion center. These are the gray matter structures, which we'll be incorporating and showing how they play along in the pathways that I have planned ahead of the PowerPoint. Along with the gray matter structures, we have the white matter structures, which form various connections in the limbic system. The first one would be the fornix, which connects the hippocampus to the hypothalamus. There's the stria terminalis, which connects the amygdala to the hypothalamus and the septal area. There's stria medullaris thalami, which connects septal area to the habenula. And there's finally the mammillothalamic tract, which connects the mammillary body to the anterior nuclei of the thalamus. Moving to the first sensory pathway, it would be the olfaction, which also means smell. If you recall, like whenever we bring a flower or an aromatic substance near our nose, the smell is like our nose smells the substance, and then smell is carried forward by the nasal cavity through the olfactory epithelial cells towards the olfactory bulb. Once the olfactory bulb is stimulated, an action potential runs down towards the lateral and medial olfactory striae. Over here, we'll be focusing on the lateral olfactory striae, which takes it to the two components of a limbic system. The first one would be the parahippocampal gyrus, and the second one would be the amygdala. The parahippocampal gyrus is associated with the smell, while the amygdala is the emotion of the smell. So often when we bring a rose close to our nose, we usually know what it smelled like earlier. There's a different type of emotion that we attach to every. So these are the parts that are responsible for it. The second pathway we'll be discussing is the memory or the learning pathway. This is also known as the Papez circuit. This usually begins at the hippocampus. If you remember three parts, it's the dentate, even end, and the subiculum and the which are the efferent phase. So the pathway begins at the subiculum, which goes via the fornix towards the mammillary body. From there, the mammillothalamic tract passes towards the anterior thalamic nuclei. From where we go towards the from the cingulate gyrus, the senses go two ways. The one that we're discussing is when the cingulate gyrus carries towards the parahippocampal gyrus and forwarding it to the entorhinal cortex. The other side, the cingulate gyrus sends the cortex. This is what's responsible for our thought processes, the decision making, and reasoning. When we move to our emotions and behavior, the emotional response fear, anger, madness, while the behavior responses would be the feeding or motivation. The emotional pathway, in the emotional responses, one of the epicenter of it all is the amygdala, which is where the the senses come from almost all parts. So the auditory association pathway, along with visual association pathway and the somatosensory association pathway, send their signals to the posterior association pathway. Now, along with the senses from here, the amygdala also sensory senses from the hippocampus, prefrontal cortex, and the temporal lobe. Information that the amygdala receives, it carries it forward via the stria terminalis towards the hypothalamus or towards the septal area, which is what incites the emotional responses, which would either be fear, anxiety. When you look at the feeding and sexual behavior, I would like you to focus on where the amygdala is sending signals to the hypothalamus via the stria terminalis. In the hypothalamus, there are two neurons which are important for our feeding behavior, which should be the nuclei and the lateral hypothalamic nuclei. The ventral medial nuclei is responsible for satiety, while the lateral hypothalamic nuclei is responsible for hunger. For sexual activity, hypothalamus has two other nuclei, which would be the paraventricular nuclei, along with medial preoptic nuclei. The paraventricular nuclei, once stimulated, releases oxytocin and increases blood flow, sex drive in turn. While the medial preoptic nuclei is responsible for increased gonadotropin releasing hormone, which in turn increases the testosterone in our body, thereby increasing the sex drive. When we look at the motivation and the reward pathway, there's sensory signals sent by the amygdala to septal area and hypothalamus via the stria terminalis, which is connected to the ventral tegmental area responsible for dopamine release in our system. The ventral tegmental area is connected to the nucleus accumbens and the prefrontal cortex via the mesolimbic pathway and the mesocortical pathway respectively. These give our body a sense of euphoria, a sense of reward, and this is what's often used in drug abuse. The nucleus accumbens is involved in the cognitive processing of motor function related to reward and reinforcement. The core encodes new motor programs which facilitate the acquisition of a given reward in the future. The prefrontal cortex is the central role and this influences perspective and cognitive flexibility. When we look at the clinical significance of the limbic, the first syndrome we'll be looking at is the Kluver-Bucy syndrome. Here, there's a bilateral temporal lobe damage. There's a damaged amygdala, which we remember was responsible for emotions, feeling of feeding, and sexual behavior. There's damage to the hippocampus, which is associated with memory. What these reflect is that the signs and symptoms that will be presented would be placidity, hyperphagia, hypersexual, and amnesia. In vernix encephalopathy, there's a vitamin B1 deficiency. There's damage. There's damage to the mammillary bodies, which are responsible in the memory pathway. Peduncles, cranial sex. The signs and symptom here would be confabulation, which would be vivid imagination, ataxia, and ophthalmoplegia. Alzheimer's disease is a there are neurodegenerative changes in the limbic system. There are amyloid proteins build up, which form amyloid clouds, which are outside the cells, while neurofibrillary tangles are formed inside the cells. These lead to neuron. The hip is one of the first areas to degenerate, and this leads to an anterograde amnesia. While the cortex also degenerates early, it leads to a retrograde amnesia and dementia. The Korsakoff syndrome is an amnestic syndrome which is caused by a thiamine deficiency. There's poor nutritional habits, chronic alcohol abuse, gastric carcinoma, hemodialysis. This is what leads to damage to the mammillary bodies and dorsomedial nucleus of the thalamus. The symptoms would include amnesia, confabulation, attention deficit, disorientation, and vision impairment. There are also changes in personality like lack of initiatives, spontaneity, lack of interest or concern. Recent memory is more effective than remote, and immediate recall is usually preserved. These would be my references for today. Thank you.
Thank you, Dr. Jaskirat. Any questions, comments? Any queries? I think we have friends also. You have any queries? Any comments? Dr. Aditi, Dr. Akriti, any comments?
Both of them done very good presentation. And the first presented very well, and the second presentation was a splendid presentation, as well as he explained everything as well. Best of future. Thank you.
As I agree with Srinivasan, the presentations have been done very well in a professional way. I would say these are professional presentations today, what we have seen. So I would congratulate both of you. I think you have a very bright future ahead of you. And the way you have put up the matter, the presentation, the confidence, the flow, the pictures, the content, it was exceptional. You know, it's a very fulfilling experience attending your presentations. At internship level, we wouldn't have done this better. And so, Jaskirat, you covered most of the parts of limbic system. Not an easy topic to be part of, because most of us, they run away from neuroanatomy or anatomical aspects. So again, congratulations to both of you. I would like to request the moderators to hand over the certificates and also click picture. Thank you.
Thank you.
We end the session here.